Hey guys, Andy Austin, 19 years as a nurse practitioner in pain management. Coming to you today, we're going to talk about some things that is really important to guys over 30 in particular. So if you're 30 years old and a guy, stay tuned, okay? And what we're talking about today is low testosterone. And now I know it's been all over the media and stuff. And basically what I want to do is come online and talk to you guys as a healthcare provider. First of all, if you have any of these symptoms we talk about, get them checked out, okay? I know there's a lot of guys are hesitant on going to their provider in general, or feel shame or embarrassed. We don't care. We just want you better, man, okay? So if you have any of these symptoms, suck it up and go to your provider and say, hey, look, this is what's going on. I need some, further evaluation checked out. It's easy. Just do it, man, okay? And if wives of guys that may be listening, get them to go. Tell them it's time to go, okay? So what we're talking about is low testosterone. And the reason why I wanted to make this video is because, my primary practice is in interventional pain management. And what we all know is chronic pain medication usage is notoriously a common cause of lowering a man's testosterone. I mean, and it's a trade-off, and it's something we educate the patients all the time. But you'll see too, there's other medicines out there that's been shown a link that can lower a guy's testosterone. In addition to what we already know already, that guess what? Since probably 1980s, naturally guys' testosterone levels are just decreasing compared to their grandfathers. So this is going to be a big deal. This is going to be a deal that's not going to go away. And if you guys that are dealing with this and are hesitant or apprehensive going, it ain't going away, man. It's just going to keep sucking. Sorry. And so there's no sense in living like that, I had a guy one time, he had the classic symptoms we're going to talk about, and he came back, his level was so low, it was 50, okay? It was in the 50s. And, that's in a normal female testosterone range, high teens to 70 is for females. A male normal testosterone level, free testosterone level, is over 300 to 1,000, okay? And so his was in the 50. And whenever we identified that problem and helped him get appropriately treated, and he came back and see us within a month later. Guys, the dude was emotional, man. He was like, dude, I didn't know how bad I was for so long, And so that always stuck out with me, that it's no sense in, suffering whenever, you can go get checked and get it treated and have a better quality of life. That's what we're about, man. That's what it's about, So, what are the signs of low testosterone? Quickly, okay? Fatigue, number one, okay? If you're sleeping 7-8 hours a night, okay? Which, if you're doing that, you're in the minority, okay, of Americans. I'm talking about Americans now, okay? But even if you're sleeping 8, 9, 10 hours a night and you're going through and you're barely getting through work and you're coming home and crashing at 5:30, and get up, eat supper or whatever, and then go to bed at 10, that's a red flag, guys. You need to be checking with your family provider. Tell them about that. Excessive fatigue, even with proper sleep, okay? New onset anxiety, depression, or irritability. Wives, you can help your husbands out here. If he's irritable more than normal, bring this up. In fact, I have a good friend of mine He's a psychologist, and one of the first things he sees guys that are in their 30s, in their 40s, that have a new onset anxiety problem. They've been referred to him for anxiety or depression. First thing he does is draw a free testosterone level on. We were talking, he said, you would not believe the number of young guys in their 30s or 40s that are being referred or even treated for anxiety and depression. That started late, started in the 30s and 40s. They have low testosterone, and it helps get their level straightened out, and that helps with anxiety and depression as well. So, also number 3, weight gain. Now, it's common, it's harder. One of the reasons why 40 and over it gets harder to keep your weight down and that type of thing is that you're naturally losing testosterone. After your early 20s, naturally you start secreting less and less testosterone. But we've seen since the 80s it's dramatically less. And so we're having more younger guys start having these problems. So if you're trying to do everything right, if you're trying to do the exercise routines and that type of thing, and you just can't get the weight off, or for whatever reason you had a bad year, if you had COVID, we are all inactive the last couple of years because of COVID, shut up in the houses and stuff. You gained a bunch of weight, say 15, 20 pounds, did your test level checked, because not only is that a sign, but excess, being obese or being overweight can actually make low testosterone worse, okay? So whatever little amount of testosterone you got going on anyway, if you're obese, it can actually convert it to estrogen, and so make your problem worse. So if you're obese, get your test level checked as well. We know all about the sexual dysfunction, desire, performance, all that kind of stuff. That's everywhere. That's a symptom of it. Brain fog. Brain fog is one that you just don't feel as sharp as you used to be. And I'm seeing more and more guys in their 40s talking like old dudes. Old dudes in their, no disrespect, old dudes in the 70s. But they're talking about like they're, oh man, just ain't as good as I used to, and that kind of stuff. Well, yeah, I get it, but dude, you're 42. I mean, buck up, dude. You're not like you're 72, man. Lord willing, you got 30, 40 plus years on this earth. Does that mean you're going to suck the rest 30, 40 years? No. So if you're having the brain fog, go get it checked out, man. If your job, it's more difficult, you just can't keep up mentally, that could be a sign of it. And also, the strength and endurance, that could be one of the things. Could be low testosterone, and these are some of the signs and symptoms that only you are going to know. And if you don't step up and say, hey, look, this ain't normal, or this is not where I want to be, or this is bothering me, it's time to go get checked, man. Just go in there and tell them. Again, we don't care, okay? This is what we do. We just want you better, okay? So there's just drop all the, embarrassment and any type of that, all that stuff you're putting on you, just drop it at the door, man. We don't care, If you're having a problem, let us know, So the normal labs, when you go see your primary care provider, they're going to, amongst other things, they're going to do a serum testosterone level, free testosterone level, okay? It's a basic little blood test. It ain't that big a deal, okay? They're going to draw a little blood work. Ideally, you want to have it drawn before 10 a.m. because in the morning is when, if you're sleeping normal, if your normal sleep pattern, your testosterone level is highest in the morning, and it decreases after 10 a.m. and it's at its lowest when there's time to go to bed. So, we've seen big swings, big changes throughout the day of people's testosterone levels. So if you're going to go get it checked, make sure you do it before 10 a.m. That's all, okay? So you've watched up to this far and you're still kind of hesitant on going to see your provider, but you have some of these issues, and you want to know, well, what can I do to try to treat this naturally? Or even if you've seen your provider and you're borderline, you're 300, 310, 250-ish, and you have some symptoms and you don't want to do the treatment, well, sleep, huge. Proper sleep hygiene is huge, man. And nobody does it. Nobody does it. Well, very small amount, okay? That's sleep at the same time, go to bed at the same time, get you good 8 hours, get up, same time as proper sleep hygiene. And so, yeah, it takes dedication, but if you want to do it, that'll help. Proper diet and weight management. So if you got the 15, 20 pound COVID added weight around your abdomen, get it off. Get it off. Eat right. Again, goes back to sleep habits. Very few people can do it because of work schedule, a lot of things. It takes dedication, okay? And then exercise routine, mix in strength training, resistance training with some cardio. There's been some research where, and this is more long distance, really elite distance runners and cyclists and stuff. But if you're doing a whole lot of cardio, like a lot, you may be in ideal tip-top shape. But if you start having some of these mental fogs, irritability, or some new anxiety, you may want to do that because sometimes in some people, if you do a whole lot of cardio training or cycling training in particular, it starts hammering your testosterone level too. So you want strength, you want resistance training, right? That's what you want. So just briefly, some of the medicine. Now, I'm gonna tell you this: never stop a medication that's been prescribed to you, and talk to your primary care provider or whoever's prescribing your medicine about it, get their opinion about it. But we're just talking about some of the medication classes that there's been some mention on, hey, these type of medications possibly could lower a man's testosterone. Now, I said the first one, pain medicine, no doubt, done. It happens. It's well documented. It's been studied for years. If you're on pain medication, opioids, it will most definitely lower your testosterone level over time. And if you're on long-acting pain medicine, look out, because it's going to do it faster, okay? Antidepressants, antipsychotics, same thing. It can lower your testosterone level. So if you're on those kind of medications, don't stop them without talking to your prescriber first, okay? All we're saying is if you're on these medications, keep a track on your testosterone level, particularly if you start having symptoms, okay? That's all we're saying. So antifungal medications, statins are the cholesterol medicines. Now, whenever, we're researching this, we come across statins, there's some more research looking into statins about lowering the testosterone level, but is it in the patient population that people that take statins they have high cholesterol, they're overweight, their diet may not be ideal. Now, I'm not talking about the genetic folks, the poor folks that they can do everything right, their cholesterol's still high. But statins, there is a link. There is a link between statin use and low testosterone level. In my opinion, I think it has a lot to do with the patient type that has to take a statin. They're at a higher risk for low test in general. So talk with your primary care provider about it. And aldactone is a hypertension medication. There's a link, and of course chemotherapy drugs can as well. So we covered a little bit. That's all we're really going to say, but I also want to leave you with this is if you are, you know, suffering with this type of thing, it's easy. There's a lot of treatments out there. There's a lot of effective treatments out there. It's extremely common. You ain't alone. I guarantee you, if you're over 30, you know somebody, some guy, one of your buddies that is on supplemental testosterone or should be, okay? So don't let ego or machoism or all that kind of crap make you, you know, hesitant on talking to your primary care provider, okay? So it's a good idea if you're over 30, over 35, particularly if you have any of the symptoms. When you have your annual, get a test level checked before 10 a.m. Throw it in there. Hey, doc, can I get a test level checked? Sure. That's it, man. All right? So, I hope you liked it. If you have any comments, questions, put them in the comments. I hope you subscribe. We're going to be doing some more of this stuff. Have a good day, and see y'all next time.